One more page.
Yes, ma'am. Ma'am, other page. Can I
Started.
start, ma'am?
Yeah.
Hello, I'm Dr. Fatma, one of the doctor in the gynae clinic. May I confirm your name and age, please?
I'm Aisha. I'm 18-year-old doctor.
How would you like me to call you?
Aisha is fine.
Okay, Aisha, how are you doing today?
Yeah, I'm fine, doctor. Thank you
And
for.
I can see that you are a student. How studies are going?
Uh, Actually, my studies are upcoming exams are there, so it's a little bit stressful. But apart
Hmm.
from that, yeah, my university exams are coming up.
Okay, all right. So, Aisha, I can gather from your GP notes that you are having some concern regarding your periods and you are here to discuss the further management. Am I right?
Yeah, actually,
Mm-hmm.
yes.
And apart from this, any other concern to discuss with me?
No, actually, I wanted to know, means he has mentioned something regarding PCOS, but he has not given me any information. So I wanted to know what it is and how we need to treat it. What are the concerns associated with this?
Yeah, I will address all your concerns. But before going on a discussion, can I ask you a few quick questions regarding your general health? How this sounds to you?
Yeah, yeah, that sounds
Okay.
great.
So, can you tell me more about your concern?
I told you, doctor, actually, I'm getting my periods quite irregularly. And in spite of taking tablet for some time, uh,
Mm-hmm.
which put on my me means my extra, I have started gaining some extra pounds, and it was
Mm-hmm.
troublesome for me also. So
Mm-hmm.
I decided not to continue this
Mm-hmm.
tablet, and that's the reason GP said I need to see you.
Okay, all right. So, may I know the name of the tablets? Do you have any idea?
Yeah, he has given me oral pills.
And for how long you use them?
I used them for almost 3 to 4 months.
Okay. And how often your periods are coming?
They are pretty irregular, doctor. Sometimes they take 2 months, sometimes they take 3 months, and then I have to take tablets. So they're pretty irregular.
Okay. When was your last menstrual date?
It must be around 1.5 months back.
All right. So since how long you're taking the medicines for the periods?
No, I'm not on any medicine. I took this COC, but I stopped that. Once I noticed that it is increasing my weight, it's increasing my
Mhm.
tummy girth, so I stopped it.
Okay. And it is from the start of your periods when you start your periods. So your periods are irregular. Am I right?
Yes, it's from my
Mhm.
start of period. I started getting my
Mhm.
periods at around 13,
Mhm.
13 year.
Mhm. Okay. So I can gather from your notes that you are having increased facial hairs growth as well. So can you tell me more about this?
Yeah, doctor, that is another concern. Although I am doing this waxing, threading, but
Mhm.
that it's quite embarrassing feeling for me. And nowadays, I
Mhm.
have noticed that there are some excess hair on my chin, on my
Mhm.
chest, some
Mhm.
small hairs on my tummy. Actually, it's
Mhm.
bothering me.
I understand it must be a difficult. So for how long you are putting weight? Like when you notice that you are putting extra weight?
I feel from the time I'm taking tablets, although I was
Mhm.
little on the chubbier side, but from that time I
Mhm.
must have.
Have you tried anything for weight reduction?
Too lazy to do it. Along with that, my
Mhm.
studies are getting affected.
Okay, all right. So Aisha, I will ask few sensitive questions, but they're important in management. Are you sexually active?
No, I'm not in any relationship. I never was in any relationship.
Mhm. Okay. And any medical problem?
No,
Any known allergies?
no,
Any surgeries in tummy down below?
no.
Any family history of concern, especially this in your mother or if you are having sister, this problem?
No, doctor. Nothing like this. My mother is little on the heavier side, and
Mhm.
apart from she's been on diabetic medication, nothing more.
All right. So are you well supported at home?
Oh yeah,
Okay. And Aisha, do you smoke?
no,
What about alcohol?
no.
Pardon me to ask, any recreational drugs?
Oh,
Okay. Thank you so much for sharing all these informations, Aisha. So now I have your report did regarding your blood test and your ultrasound, and I have confirmed your identity. Did GP discuss with you the report?
he just mentioned it is PCOS.
Yeah, exactly. Okay, so let me first of all explain what is a PCO. So the Aisha, the PCO is basically a condition in which the in the ovaries, the edge of the ovaries are covered by small fluid-filled cyst. We call that the follicles. Okay, so they are gathered in the ovaries, and ovaries become more than the normal weight. Am I clear so far? Like weight
Yeah,
in
that
volume
means
increase.
they are okay. They are big enough. Okay.
Yeah, yeah. So they are big than the usual. And it is not a life-threatening condition, okay, Aisha, but this is a chronic condition. Like it has certain
My
implication
God.
on your health. Am I clear so far?
Okay. Okay.
And your hormonal profile, like your blood test and your ultrasound are suggestive of the same that you are having a polycystic ovary syndrome. Uh,
Hmm.
like yeah, so if a girl or woman is having this condition, there is increased tendency to weight gain. There is increased facial hairs. Okay, periods are sometimes irregular, and sometimes they feel a difficulty in the getting pregnant. And along with that, the lifelong these women, I'm not saying that all women get these lifelong effects, but sometimes um, there is increased risk of getting the increased blood sugar levels. We call it the diabetes, increased heart problems, and increased thickening of the lining of the womb. And later on, there is increased risk of cancer of lining of the womb. But they are very rare. Am I clear so far?
Okay. Okay.
Mhm. Yeah. So it's quite common, like 25 out of the 100 women in the UK may face this problem, Aisha. So now I will discuss the management plan with you. Any concern before going on a management you want to discuss with me?
Actually, I'm just not keen on these pills. I don't want to take
Mhm.
these pills.
All right. So, Sarah, sorry, Aisha, you told me that you are concerned about your weight gain with these pills. Apart from this, any other concern with these pills?
No. No.
Advantages and disadvantage of these pills, and at the end you will decide by yourself. Okay, we'll respect your wishes. So, but I'm here to help and support you. And at the end, I will give you all the written information regarding this PCO. I will connect you to the support groups, and I will write back to your GP. How this sounds to you?
Okay.
Okay. So, Sarah, sorry, Aisha, regarding your concerns, your main concern is these infrequent periods, and along with this, there is a facial hair. So we do have our lifestyle modifications, and we do have a medical treatment. Regarding lifestyle modification, it is very important to lose few pounds, because when you will lose few your weight, like even 10 to 15% reduction of the weight will resume your periods. You will ovulate regularly, and you will get your periods on a monthly basis. Am I clear so far?
Okay. Okay. Okay.
Yeah, I understand with the study and
It's
all
very
these things. It's
difficult,
very
doctor. It's very difficult to lose a weight. I have tried
I
and
understand. Yeah, I understand. And with the even with the PCO, it's really difficult to lose the weight. So for this, I can connect you to the dietitian and the exercise specialist, and I can connect you to the support group that is a slimming ward. After your exams, you can join, and you can talk to the women who are having the same problem. It will give a new way to manage your symptoms. Am I clear so far?
Okay.
Okay. And along with that, regarding the oral, for the irregular periods, we usually advise pills. But as you have taken the oral contraceptive pills, so we do have a new form of the pills that contain a specialized hormone that can improve your these problem of the facial hairs as well, and it will regulate your periods as well.
What is that? What is that pill, doctor? I haven't heard about it.
Yeah. So that pill name is Dynate 35. This the procedure
Okay.
is
What
same.
it
You will take,
contains?
yeah,
What it
you will take
contains?
it contain a new hormone that is the anti-androgenic. Like it will antagonize the male hormone that your ovaries are producing more. Am I clear so far? And
Okay.
that's why you're having these facial hairs and all these problems. And along with that, it
Okay.
will protect your lining of the womb as well. You will get your monthly periods, okay, and it will reduce your hair growth as well. And you can take it for 21 day with the 7-day gap, and you can take it for 3 to 6 months. And there is very little association with the weight gain. Am I clear so far?
Okay.
Yeah.
Okay.
So
Okay.
as so Aisha, any other concern?
No, doctor, I am just not that keen, but you are saying this new pills are better off. I may consider
Yeah.
it.
So it will
Oh.
improve your periods. It will improve your like complaint of the facial hairs. Along with that, you can continue your the conservative methods like the waxing and the plucking, and even there is a new method of laser as well. Okay. So, Aisha, these are the
Hmm.
medicines which will give you all these benefits, but it has certain side effects, but they are manageable. Like sometimes you can feel bloating or the breast pain or sometimes headache, but these are manageable things. Am I clear so far?
Okay.
Okay. And before prescribing this, Aisha, I'm not going to be judgmental, but we have to complete our investigations. So I will send your urine for pregnancy test. Am I clear so far? To make sure that everything is okay.
Yeah,
Although
it's
you
okay,
told me
doctor,
that,
but yeah, I'm not having any relationship, but yeah, you can go ahead.
yeah. So it's just for completion of completing our, the loop of the investigations. So, what are your thoughts? Along with that, you can continue your weight reduction, and if the things will not improve, then we will have another meeting with my consultant after 3 to 6 months, and we will discuss the things further with you.
Okay, doctor.
Hmm. So, are you okay to take the pills?
Yeah, I will think. Yeah.
Okay, so as you do not bleed for 1.5 month after checking pregnancy test, we will give you some pills that are the progesterone pills, and it will you will take for 5 to 8 days, and once you will bleeding will start, then you will start taking it from day 1 or 2, and then you will continue for 21 day with the 7-day gap, and you will continue for 3 to 6 around 6 months. Am I clear so far?
Okay.
Mhm. Okay, and along with that, I will encourage you to maintain your healthy lifestyle. Okay, and eat healthy.
Okay.
And so Aisha, here is the patient information leaflet. Okay, and I will book another consultation with my consultant. I will write back to your GP.
Okay. Okay.
So anything else you want to know?
No, doctor, thank you.
Thank you.
Okay. So your own feedback, then we will go through the others'
Ma'am,
feedback.
actually, I was like thinking that she's not sexually active. She don't have any concern regarding pregnancy or anything. So we should manage
Yeah,
her
so
the
we should not, yeah,
complaint.
yeah, we should not, no, no, we should not come up in the answer key, although it has been mentioned, but I don't think it is mandatory. As of now, her concern will be her appearance.
Yeah,
Okay,
exactly.
and her
And
cycles,
wait,
her cycles. Yeah, max to
Yeah.
max, you can just say one word that, see, PCOS, PIL says PCOS is a condition which will affect your cycle, your
Appearance.
menstrual cycle. Yeah, menstrual cycle, appearance,
Mm.
fertility, and hormones.
Yes, ma'am.
Okay, so in one word, if you can mention it. So, see, why I suggest this, use the language which PIL is giving.
Yes,
It
ma'am.
will give you more impact, and communication with colleague, it will be easier for you to pass. They want that kind of language because they're reading in and out. Na?
Yes, ma'am.
Okay, so in one word, you could have explained that this is a condition in which the ovaries get bulkier on inside, and draw, dear, draw. Hmm? Diagram.
Yes, ma'am.
Okay. So that is one concern what I was having. Apart from that, history taking 5 minutes.
It's 5 minutes.
Yeah. Basically, this is actually a teenager rapport building and all those things, maybe because of that. But quickly take her a relevant history only. So relevant history, I think the history of menstrual complaints, you took too much in detail, and I don't know why you took it into so much of details. Uh, one more question means one or two more questions, and it could have been finished it off. So, according to me, a little more history in menstrual history. You took little more time in menstrual history. Rest of the history was okay. I will not say any significant flaws in the rest of the history. Uh, that's it. What is there in information gathering? Very good. You didn't offer her examination. Here, what you say when such kind of task is there, where there are no names, no NHS number, and no GP letter. So I will say, rather than saying I confirm your name and NHS number, I say according to your GP, he has mentioned that your hormonal profile and ultrasonography suggest your PCOS in this format, because here no GP letter, no, in if it is GP letter also, and in the GP letter if the investigations has been mentioned, then because it is not, you are not cross checking that investigation, you are just confirming the findings of GP. So please ensure that you will use that word according to the GP letter. Your these investigations are like this. Here, according to GP letter, your hormonal profile and ultrasonography is showing PCOS. Checking her background knowledge, very important. Even I, although I said okay, I wanted to know, but do you know, have any idea about your reports? Do you have any idea about PCOS? It's always better. Okay, that is one point which I had mentioned here. Support group name, if you can mention. Verity is a support group for slim one is for weight, this weight
Slimming
management.
word. Yeah, slimming word, ma'am.
Yes, yeah,
Okay.
even if it is weight watcher. Hmm?
Hmm. Ma'am, in the
Weight
start,
watcher
you said
is,
I don't have any idea about this PCO, so that's why GP said me here. He just told me that I'm having PCO. That's why I didn't ask.
I wanted to know, yeah. So, but make it a point when you are explaining, at that point, at
Yes,
least
ma'am.
ask. Okay, any
Okay.
basic idea. I might be having some, he's mentioned something about PCOS, some spelling on ovary, something like that. Beyond that, I am not having any idea. So, okay. So, yes, I wanted to know about PCOS in detail. Then that is okay. BMI, you had to acknowledge that I have noticed that your BMI is on little on higher side. Acknowledge that information. As you
Okay.
rightly acknowledge that she is having hirsutism, but her BMI is also needs to be acknowledged.
Mm-hmm. Okay.
Okay, yeah, because then the examiner might think that you have not noticed her BMI, even though you had offered me the options of lifestyle means lifestyle, yeah. And from where you have noticed, this question is also irrelevant when it comes to, means when did you notice that you have started gaining weight. So it doesn't mean anything now, it is going to take your history time only, because now she is
Okay.
having a, anyway, whether this is associated with COC or whether this is associated with PCOS, she is having a tendency to gain weight. Now her BMI is 30, so you can skip that question. Okay. I can, yeah, I can
Okay,
see
ma'am.
that your BMI is on little on a higher side. That is another point which I had mentioned here. Support group need to be mentioned for PCOS. Checking. Sarah, name Sarah. Why Sarah? It is Aisha. once in a while.
I said
This
twice,
kind of
Sarah.
things, yeah, this time, this kind of things do happen. Please say sorry, sorry for wrong, naming you wrong. Okay, please say sorry. At least they should realize that, okay, you yourself realize that she's not Sarah. Okay, I didn't say I'm not Sarah. I was about to say, but then you said, oh, sorry, Aisha.
Yes, ma'am.
So if you have realized now, apologize. Okay, especially if it is late. Apart from that, I think it was a straight station. Um, Management, you could have given little better because of lack of time. You couldn't complete it. You took extra 2 minutes. Okay, extra 2 minutes, 12 minutes time you took. So management could have been completed within that 10 minutes time. Management was appropriate counseling for COC, that to newer COCs, which will contain cytotrione acetate, which is anti-androgenic. Yes or no? Or what to you?
Yes, ma'am.
Drospirin or cytotrione acetate? Which drug you are going to give?
Cypriot on
And yeah, yeah. So take a name of this medication. Okay, take a name of this medication. Another point, what I think, she's 18 years, so you can ask, would you like to involve someone in your care? That one question also can be asked. If so, we can means whenever you will be seeing you next time, come along with your means family member or mother. Okay, so
Okay,
that
ma'am.
can be asked because she's just 18 years. So that is only my concerns. Apart from that, I don't think there wasn't anything. Anybody wants to say anything about this performance? Then after that, we will go through the answer key in short.
Ma'am, for this patient, like we should offer her the this Dinet 35, like is the cyproterone acetate and
Dinet
the weight.
35, Dinet 35 is yeah, yes.
Yeah, but
But
we
then
can give
don't
her
take a trade name. Don't take a trade name
yes,
because
yes, ma'am.
they might not be having the same name. So you can just say that a newer progesterone which will contain cyproterone acetate along with estrogen. These hormones will be given to you. These are a good hormones because it will minimizes the weight gain and also minimizes the excess hair growth since they are anti-androgenic. Hmm? So this is showing your knowledge. So rather than taking a brand name, you can tell them and we will tell you how to take it. Do not miss it out. That's it. Take it
Okay,
regularly. Do not miss it out. You can take it till 6 months and we would like to review you after 6 months. Okay. Per se from her history, there isn't any contraindication to this. Okay. So that's it. I don't think anybody wants to comment on her performance. Anything which you think, okay, she has not because
Ma'am,
this is hirsutism.
OCP is
Hirsutism. I'm really thinking that since long time they have not given. So in upcoming 1, 2, 3 years, they might give any new task regarding hirsutism. So at least basic information, at least basic knowledge about hirsutism, you need to know. Okay. Yes, Rekha.
ma'am, according to the FSRH, OCP is there is insufficient evidence that it caused the weight gain.
It is, see, she is blaming OCP. It could be because of the COC or it could be because of her PCOS. We know that
PCU,
COC
yes.
causes water retention. COC causes water retention, especially progesterone part. And that could be the
Mm-hmm.
reason that she is thinking that it is associated with COC. So, anyways, she is having two things. She is having hirsutism. So, your change of
Mm-hmm.
progesterone COC will make sense. So, rather than thinking and rather than convincing, no, COC will not be increasing, you can just tell her that we will be
Mm-hmm.
offering you alternative COC, which will help her to
Mm-hmm.
reduce her weight also and help her
Mm-hmm.
to minimizes the excess hair growth.
Okay,
So
that's fine.
that way,
Okay.
okay. So too much of
Okay.
knowledge
Yeah.
also will kill you. Just listen to the
Mm-hmm.
concern. Ultimately,
Yeah.
your
Okay.
option is, yeah. You max to max say that okay, but here if you want to be more safe, yeah, it has seen that many women complaint it is associated with increased weight gain, but in the evidence based medicine, it has not shown any such side effect of COC. You can mention that if you want to be very thorough with your evidence-based medicine or FSRH guideline. Okay, but I feel it is okay because many a times they do have this side effect. It is not statistically significant,
Okay,
what they
doctor.
say. Yeah,
Okay, I got
statistically
your point.
significant, then they will, yeah, then they will be like, yes, it is there. The same way it is associated with CA cervix, but it is not associated with statistically significant. That COC is a risk factor.
Yes, yeah, yes,
Yeah,
yes, ma'am,
so
yes,
something
I
like
got your point.
okay, something like that. So the observation is there, but it is not statistically proven. So they are like, okay, they are just making it
Hmm.
bolder statements.
Mm-hmm. Yes, I get your point. Okay.
Okay, anybody wants to comment on anything?
Ma'am, is this station from any book?
Yeah, very nicely she puts it from that Isaac book. I am also having that book now. Isaac.
Okay, ma'am.
Okay.
Ma'am, connecting with the weight management team, exercise
Yeah,
groups for weight
she
loss.
yes, yeah. She that slimming one. She mentioned slimming one is a support
Okay,
group.
okay.
Okay. So although in the answer key they had mentioned about fertility and all those things, but at 18 year of age, my concern, even I would not have said that I wanted to get conceived. So how I'm going to conceive and all those things. No, it is not needed for me. Okay. One more point, Dr. Fatima, you could have emphasized that lifestyle measures, if you taken seriously, it will minimizes
Okay.
the long-term complication of PCOS
Yes,
like
ma'am.
diabetes, high blood pressure, endometrial cancer, hyperplasia, or thickness of the lining of the womb, and sometimes mental disorder and even obesity. Okay, so these complications can be reduced with the help of effective lifestyle management. So I will suggest and encourage you to consider it as a primary treatment, primary treatment. Okay, that is what I wanted to see. Means you have to give her a positive counseling, so she should continue consider it that this is the best medicine for her. Then comes the COC. Then comes the COC. Another point is okay. So nobody is having any feedback for her. So my answer key is teenage
Ma'am,
format because
like
she's
Dr.
just
Fatma mentioned about neurotherapy like laser, but laser like the
you can
it is
mention
also yes, she mentioned, yeah.
yeah, so see, regarding hirsutism only, I wanted to put on some emphasis because she is having hirsutism on her chest, on her abdomen. So, what do you think that Faraman Galvez score that is very high? That score
Yes,
is
very
very
high.
high.
Yes, very high.
Yeah,
Yes.
and then the treatment will be something where you need to involve, I feel I will involve my consultant, and if needed I may involve the endocrinologist also to see
Yes,
whether
yes,
there is
ma'am.
any, yeah, whether there are any other androgenic abnormality. So that is my only concern because it's better to say that would like to means would like to get assessed by the endocrinologist regarding this hirsutism. Okay, PCOS per se will not have this kind of hirsutism.
Yes,
PCOS
ma'am.
per
So
se will, yeah, is this
we should
extreme.
send.
Although, hmm,
I should send the further investigations like the testosterone and all these things.
yeah, you can. You said this. I didn't listen actually. You said this.
No, no further
Yeah.
investigation.
So,
I didn't
yeah,
know
yeah,
about that.
yeah. So I would like to investigate and get yourself assessed by an endocrinologist because you are having that there is a special score. He will be coming. He or she will be assessing you and send some test. Meanwhile, you can continue this medication, something like that COC, what we had said, and alternative treatment for your hirsutism or excess hair growth, that is waxing, bleaching, laser. Okay, the most common is vaccine, bleaching, and laser. Along with that, the COC will minimizes. And depending upon the score and for the further investigation, we will offer you effective treatment. Teenage format intro rapport building was very nice. Aim by GP, discuss irregular periods and PCOS. Concerns you very nicely asked. Setting agenda was quick. Open question regarding menstrual history, menarche. Closed question, she might hide some information. So menarche, regular, irregular treatment right, you asked me, but here again you emphasized more on treatment right. You can just quickly take and go ahead. Okay, PCOS, weight gain, excess hair growth, dark skin, BMI is already mentioned, so you just acknowledge. See, with these things now, patients are many a times mentally little bit disturbed. So you can ask this history also, mental history in PCOS, especially in a teenager. Okay, so is it affecting you badly? Is it affecting you emotionally? Do not ask those two questions. You can just simply ask this question. So do you get affected emotionally, mentally, physically because of all these things? Okay, sexual history after signposting, but here it was not there, so I don't want to put means open any other channel. Medical, surgical, allergy, family history of similar condition, and family history of support. Whom do you stay? Okay, that is important. When you are explaining, explain PCOS according to PIL. According to PIL, draw diagram. I always say draw diagram. Explain hirsutism and why it is so. Okay, so this condition, there is a hormonal imbalance and more hormones which is causing excess hair growth, and that's the reason this PCOS secretes more hormone which increases the excess hair growth, and that's the reason you are experiencing this. But we need to evaluate. Here only you can say we need to evaluate whether it is associated with this, or mm, uh, we need to involve a specialist endocrinologist to see whether there are any concern. Something like that you can then and there only say. Implications, yes, short term and long term implication. Short term implication affect your appearance because of this excess hair growth, obesity, and irregular periods. Long term implications, you had mentioned diabetes, hypertension, endometrial CA, sleep apnea is another concern, and cardiac arrest. Okay, sudden cardiac death because of all those reasons. uh, Endometrial cancer is long term, and mental illness, mental problem. Irregular period, weight gain, subfertility. Subfertility also will come in her case as a long term thing. It will not be short term because she's just 18 now. So you might find it difficult to get pregnant on your own in future. uh, okay, now support group, I had mentioned about Verity, which is a support group. Treatment option, so treatment option is negotiation task. Okay, you remember that you noticed that this is a negotiation task. I am not keen on COC, but you have to give me COC. Lifestyle measure, exercise, BMI, diet less than 25, weight watcher, and group exercises. So weight watcher is my support group. Your support group is different. Any support group can be given here. Now, excess hair cosmetic treatment involve consultant endocrinologist assessment of severity by some score which is known as Perriman-Galway score, and may need some investigations also. So, newer COCs, newer progesterone, check contraindication. So, contraindication you ruled out that she is not having any medical history, any family history which is suggestive of VTE or something like that. Or here you also you can ask. So, any blood clot history in your family, because these are newer drugs more prone for VTE. Any cancer, any blood clot, any other concerns in your health. Weight gain, less weight gain as less water retention. These are anti-androgenic and having some effect where it will minimizes the water retention. Okay, if at all you get time, at least say something, or you can just say that this is having an advantage that it is associated. The side effect of other COCs will be there, definitely some gastric upset. You have to take this compliance, otherwise breakthrough bleeding and all those things will be there. But regularization of your cycles and minimization of your excess hair growth, less weight gain compared to other pills. uh, okay, regularized cycle. Now PIL of PCOS, please mention the PIL of PCOS, PIL of hirsutism. Involve parents in her care, document and close the group. Okay, simple task, very simple task, but this hirsutism has made it little bit challenging for us. Okay, and since it was a teenager, I will not say that we need to explain her or guide her regarding subfertility. That is my way.